PinPoint Health Show. We're back on the air here. PinPointHealth.ca 1-855-55 Dr. Lou DRLOU to reach out. Same goes for social as well. If you're on Instagram or Facebook, a real presence building there, pal. You got some good stuff, including videos and I won't say how-to stuff, but it's great knowledge for people to have moving forward. So I know you're always building on that. What's going on, pal?
Not too much. Yeah, the social thing is the biggest thing about it is supposed to be the visual component. Yep. So we obviously have the audio that happens here, but there are a lot of things when we're talking about this stuff that we can't really relay properly over the airwaves. And so the best way is follow us on Instagram or Facebook, or as John says, Insta. But check PinPoint Health, Dr. Lou, all of those things. You can follow my personal page, and all of those things are intertwined. And again, there'll be snippets of the show with little things that are sort of highlights from the show, but as well the visual component of any exercises or visual descriptions that we might need to go through. So some very interesting stuff. I'm really happy with it. And PinPoint Health as well. That's right. The new brand that we are going. This is the PinPoint Health Show now. And again, nothing changes in terms of the quality of service, the people that we have. It was really just a matter of a standardized brand, so that there's an accountability factor, so that people have a safe place that they can go, that they know is affiliated with me in the radio show, which provides, I think, a tremendous amount of accountability. I've said this, hundreds of times on the show. We've gotten calls about the compliments, and I love hearing those, and I'm very happy that people are happy. But equally so, I want to hear if there's ever any concerns that people have had, either with me, myself, with my assessments, or with anybody in my team. We really strive to make it's healthcare, right? So part of healthcare is also the psychosocial, which is what we talk about. Yep. So I mean, if you're going somewhere and you feel stressed about the interactions, anything about it, well, then that's not true health, right? So our whole goal here is to make this as stress-free as possible. We want to make sure that you're getting the care that you need, and more than just those things, the stress of it, we want to make sure that you understand what is happening, that you are informed from start to end, that you understand why certain questions are being asked, all the way to why a certain test would be ordered. What are we thinking when we're going through the differential diagnosis and the diagnosis? We're including you in the plan of management. That's a big thing with plan of management for patients, not just for us, but for any healthcare professional, is also including what the patient wants in that, and what the patient's expectations might be, and what their goals are. Because of course, we may think that something is the best intervention for a certain injury or a certain pathology, but what if the patient doesn't want to do that, right? You have to be comfortable, and that's very important. And the great thing is we have so many tools at our disposal that if you're not okay with one thing, we have something else that we can likely do. Now, we'll be honest if we don't think it's necessarily going to be as effective for what it is you require, but you... Oh, okay. So we have different tools for effectiveness, and we really try to tailor our care to what we believe is best, but also what the patient requires.
Well, one of the things you've always done, even before you rebranded and took more control, and even on the phones when we get phone calls here in the show, so many cases we hear of doctors at every level. They see a patient, and maybe it's not a bad thing. They're not doing it with any sort of malice. They'll just say, "Here's what you need. Here's a pill, or here's this," and they just kind of send them off. And the patient's like, how about a little bit more explanation of why I'm doing this? And that builds anxiety, right?
Yeah, and it's a systemic problem within our system, right? Like we do have a system that is very backlogged. I totally agree with you. Right. I don't think there's any malice. I don't think any healthcare professional is out there to do horrible things, right? Everybody gets into some type of a healthcare profession because they want to help people, because they want to do something that can make someone else's life better. But unfortunately, when it comes to backlogs in the system, time management, things like pay as well for doctors, all those things matter. And unfortunately, it does sometimes the really where the issue is at the end part, at the end user, which is the patient, right? They are the ones that are going to necessarily, it's what you just said is not an atypical type of presentation where someone comes in, doctor does something, doctor then tells patient, here's what you have, here's what you should do, bye. And, if that lasts 5-7 minutes, sometimes that's like even maybe an overestimation.
Right.
But there's no way that in that amount of time, you can get all the knowledge that you possibly require about what you have going on. And I think that's something that at PinPoint Health, we're really, really trying to do different. I could tell you that the biggest part of my interaction when I see a patient is spent explaining, and anybody who's ever seen me could testify to that. They could give you that testimonial that that's really what I try to make sure is that people understand from start to finish what's going on. That and I get a lot of people that already come in with, they know what's wrong, they know the diagnosis, they have all the documentation to prove the diagnosis, but they turn to me and say, I don't understand it. I've tried to do my own research on Google, I've tried to look things up, but it's just too complicated for me to understand. Can you break it down? And that's exactly what I'll do. I will make sure that I agree with the diagnosis, obviously, as from a due diligence perspective, but oftentimes I do, and oftentimes it's really about, okay, here's what it is, but also understanding the intrinsics of the diagnosis. So a good example with that is if you understand spinal stenosis and you understand what it is, you don't have to memorize that flexion-based exercises for your low back are good for you. You will inherently understand it. And that's no different than when people go through school. And you always talk about it's better if you understand because you don't need to memorize. Because when you're memorizing, you're able to forget. Whereas when something is ingrained in you, you understand it, it becomes second nature. And that's what we want, is we want people to understand the extent of the things that are going wrong with them and how they can make it better.
Lots still to come here. Stick around. You want to reach out, 1-855-55 Dr. Lou, DRLOU, and then through email is info@pinpointhealth.ca. That's the same for the website. And social media as well. PinPoint Health Show continues. Global News Radio.
Feels so weird not
You just
doing
had to